So now I'm going to do a visual field exam. So you cover your eye with that piece of paper and I will cover mine, and we're going to look at each other with the eye that's not covered. And then you just tell me how many fingers I'm holding up as we go through the fields.
2, 1, 2,
Okay, and then you're going to switch your eyes.
1, 2, 2.
Okay. So now we're going to turn and face the camera here. Okay, so I'm going to do this, what's called the whisper test. I'm going to stand behind you, and I need you to plug one of your ears. I'm going to whisper 3 letters, and you just tell me what they are.
Okay. ACF.
Okay, and then plug your other ear.
CBD.
Right. Now I'm going to do the Renee test. I'm going to hit this tuning fork. It's going to make a vibration sound. I'm going to place it on the mastoid bone. And when you no longer hear the sound, just let me know, and I'm going to immediately put it in front of your ear. When you no longer hear that sound, just let me know.
Okay.
Okay, so the difference between the two was 19 and 26. It took 26 seconds for you to not hear the sound in front of the ear, which is normal because air conduction lasts longer than bone conduction. So I'm going to do the same thing on this ear.
Okay. Okay.
So for this one, it was 17 seconds on your bone conduction, and then for air, it was 19 seconds. So now I'm going to move on to the abdominal exam. First, I'm going to inspect the abdomen. The skin color is appropriate for ethnicity. The skin is intact. There are no lesions, striae, or scars present. No hernias can be seen. The stomach is flat and symmetrical, and your umbilicus is midline. And now I'm going to move on. I'm going to auscultate all 4 quadrants for vowel sounds using the diaphragm. So the vowel sounds are active, audible, and now I'm going to move on to the vascular sounds. I'm going to use the bell of my stethoscope to listen for the aorta, the renal arteries, the iliac arteries, and then the femoral arteries. No, I cannot hear any bruise, which is a normal finding. Next, I'm going to percuss along your abdomen. I would note a dullness in sound over your solid organs, and then a tympany sound over the air-filled organs. Okay, and now I'm going to percuss for the liver. So I'm going to start in the right lung area along the midclavicular line. And I'm going to percuss down until I hear the dullness. This is going to signal the upper border of the liver. So now I'm going to palpate up along the midclavicular line, which will, until I hear dullness, which will indicate the lower border of the liver. Now I'm going to measure the distance between the two. And the distance is 7.5 centimeters, which a normal is between 6 and 12. Now I'm going to percuss over the left upper quadrant for the stomach. The sound should be a tympany sound. And now I'm going to have you roll towards me so that I can percuss the spleen. So starting at about the 6th rib down along the mid-axillary line. Just a little. And then could you take a deep breath in? And the tympany sound should be heard even as the patient takes the deep breath in. Okay, you can roll back. Okay, so now I'm going to lightly palpate your abdomen. Do you feel any tenderness or pain? No. And now I'm going to deeply palpate. As I'm doing this, I'm looking for any facial expressions that would signify pain. Are you having any pain or tenderness as I do that?
No, not at all.
Okay. Now I'm going to palpate for the liver. I'm going to put my left hand under the 12th rib, and then you can relax. And then I'm going to push up. As I'm pushing up, I'm going to put my right hand below the costal margin and push down. And then take a deep breath in and let it out. The liver moves down with inspiration. Do it one more time. Okay. And now I'm going to palpate for the spleen. So I'm going to put my right hand below the costal margin and push up along the 10th and 12th rib, and then I'm going to palpate down. And then take a deep breath in and breathe out. And a normal spleen that's not enlarged should not be palpable. So moving on, I'm going to palpate the kidneys. I'm going to put my left hand underneath the 12th rib and push up, and then I'm going to push down and then take a deep breath. Okay. Then I'm going to do the same on this side. Okay. So now I'm going to feel for the abdominal aorta. I'm going to place my thumb and fingers on either side. And lastly, I'm going to test the abdominal muscles. So I'm going to stroke this on your stomach. And the muscles that are on the side that I'm stroking should contract. And then the umbilicus will deviate towards the area that I stroked.